Hi, this is Isabel. I'm going to talk about Dr. Susan Ahmed and aspects of her practice. She's a licensed clinical psychologist with almost 5 years experience in private practice in the state of Washington. She's a graduate of our STEAM school, California School of Professional Psychology at Alliant International University in San Diego, California. Her training is grounded in evidence-based practices, including cognitive behavioral therapies, as well as mindfulness-based, trauma-informed, developmental, psychodynamic, and systems approaches. She provides therapy for adults ages 20 to 30, mostly women of color. Naturally, being someone who identifies as Black and brown, she has a propensity and desire to support other multicultural folks, and especially women. A big part of it is her identity, her own identity, being a child of immigrants, being aware of the barriers, the dynamics that can occur, microaggressions. Likewise, working with mentors and supervisors who are women of color has been part of what has influenced her. She has supported people in navigating a broad range of challenges, including immigration proceedings and trauma, integrating anti-oppression and anti-racism framework into her theoretical work, into her therapeutic work. Law and ethics has played definitely played a role in her profession. Ethical dilemmas when considering culture, example, corporal punishment, which is common in certain cultures, can become tricky, especially when she was a new clinician. Certainly, there was anxiety about identifying abuse and needing to report to child protective services. But later in her career, she has come to see it as part of a bigger picture. That takes away the need to report immediately, as long as they're not an immediate threat. It is something she keeps in mind, so she might try to engage in respectful dialogue to clarify the family values. Appreciate that some cultures may express a value and seek a therapeutic solution that satisfies the values of her clients. However, if there is a serious threat to a fundamental value, such as a threat to the safety of a client, and no acceptable solution can be found, it may be appropriate to allow Western notions of beneficence to temporarily trump respect for culture and autonomy. In this age of Zoom calls and video therapy, one thing that comes up in her practice is the nature of someone who's attending therapy from home. Sometimes clients will be moving around in their homes, and that can blur boundaries a little versus if you were to be in an office space. There are concerns about privacy and confidentiality. Other than that, it's been pretty similar to having seen people in therapy in session in person. There are challenges, of course, that she faces in her current profession. Like most clinicians, she screens clients who are at risk for suicidality to make sure that she provides all the necessary support to her clients. And sometimes her clients may endorse some vague ideation of suicidal ideation. So she may take note of that and make sure to assess every now and then, and to check on how that is, if that is showing up still. Other than that, she hasn't run into any challenges with that. Although in her internship, in her graduate school, she has had to report and had made a possible 5150 of an 8-year-old who was reporting a desire to kill himself. Luckily, she got a quick response, and the staff she was working with were very helpful. She did notice some disconnect between the staff that she worked with in the school. She thinks there was some systemic barriers or resistance really being there for the students. She hasn't had many ethical issues, luckily, but if it does come up, she consults with colleagues in private practice or conflict groups, even her former supervisors. Law and ethics does play a role in her supervisory role. As a supervisor, she does consultations surrounding the issues of boundaries, dual relationships, and out-of-state practice have come up. So, of course, she talks about issues and the limits to working with clients out of the state of her license, and things around boundaries, supervisory relationship, being able to set boundaries around keeping her email communications around logistics versus talking about content in the emails or processing anything in the session rather than communicating it through email. Making sure that transfer of information through the cyberspace is protected and safe. Dr. Ahmed thinks the current licensing regulations for the clinical psychology profession is pretty much balanced vis-a-vis safety and the day-to-day practices, day-to-day realities of her practices. She thinks it errs on the side of protecting clients, not doing harm to them, but in reality, she observes that a lot of practitioners or clinicians are really anxious and fearful about ethical and legal issues and the extreme versions of what could happen. She sees it as an effective way to prevent things from happening, but definitely there is a lot of self-protection going on, and among clinicians wanting to make sure that they're not doing the wrong thing and that their license are not threatened, as making sure that um, they're doing the best in the interest of their clients. She certainly foresees some challenges that could come up for individuals entering the professions of clinical psychology, the changing structure of therapy into telehealth settings, challenges around boundaries with clients can come up, the potential for email or texting or trying to reach out through social media, and ethics around systemic dynamics, being mindful of racism and oppression, and is something that is especially that she thinks is we needed right now. The future of clinical psychology profession is definitely going to be around mindfulness. Nowadays it's used a lot. The teaching around mind-body awareness is going to be big, and it's important for psychologists to be able to educate clients and provide those tools. There's also a movement in the profession towards needing to collaborate more with other mental health professionals, whether it's just communicating with a client, different values, different providers, or just coming up with more education around health and wellness as a holistic thing, rather than the mind being separate from anything else. There's definitely interdisciplinary work that needs to happen with other mental health professionals.